So thank you for the introduction. So today I'll be talking to you about my project and how it's linked to sustainability. And I'd like to also begin with the land acknowledgements because I'll be working with indigenous communities. As an international student, I do acknowledge the land on which I study and reside. And I do acknowledge that it's been protected for many years by indigenous people, such as the Haudenosaunee and the Anishinaabeg Nation. I also appreciate the opportunity which will be given me to work in Kaniwage, which is an indigenous community near Montreal. So this will be the outline of my presentation. I'd like to begin by giving a context of indigenous people's health inequities. What is that? It's a known fact that many chronic diseases are suffered by indigenous people here in Canada, and they also have low life expectancy as compared to the regular Canadian. But why is that? This is as a result of what we call social determinants of indigenous people's health. So these are factors that are firmly rooted in colonialism and racism. It has led to a lot of disproportionate health outcomes, such as diabetes and hypertension. What we don't know is that indigenous people do not want this narrative, and they are actually doing something about it. And so they are exhibiting self-determination to improving their health. This is not to say that there aren't issues. There still are issues, and diabetes is one of the main issues here in Canada. Let's look at some statistics. Sorry about this, but we realize that when it comes to diabetes prevalence in Canada, it's highly prevalent in indigenous people. In indigenous people, we have First Nations, Métis, and Inuit. And when we look at the numbers, we see that there's a high peak amongst the First Nations, meaning that there's a big problem. Also, we realize that the most common diabetes in Canada is type 2 diabetes, which is a type of diabetes that occurs later in life due to certain lifestyle habits. We also realize that some new studies are finding an increase amongst children and the youth, and usually this has been, an adult disease. So what is happening? We realize that communities and First Nations are actively doing something about it, and I'd like to share some examples with you. So when you look here, you realize that in Ontario, we have what we call the Sunday Lake Health Diabetes Project. Here in Quebec, we have the Kaniwage School Diabetes Prevention Program. So what is this? These are community-led activities that actually do interventions in the community, and they're also school-based. That's because the indigenous people always have the need of addressing health of their future generations. So let's look at KSDPP, which I'll be referring to in subsequent slides. It's a 30-year-old community-sustained prevention. It was established in 1994, and I believe most of us were not born, if I do account, in 1994. And it was established between community elders and researchers to actively prevent type 2 diabetes. As I mentioned, it was community-led, and it had a short-term goal of let's improve the healthy lifestyle of our community members, and a long-term goal of let's prevent type 2 diabetes. So what has been the impact? The impact has been very positive. When you look at the new cases of diabetes, it has really stabilized. However, we still have a problem of diabetes. And then when we look at the intervention that was started by the KSDPP, it has not been sustained. Some of the effects can be COVID because the pandemic actually disrupted some of the activities within the community. And some of the old elders who actually started the KSDPP has not been able to sustain this as we want. So what do? Let's go to the community. This is Kaniwage. It's located south of Montreal. And we realize that it's one of 8 communities that make up the Mohawk Nation. There's something very unique about the community. Most of their services are decentralized. And so, as against other indigenous communities, they own their own health, their own education, and social services. We also see that they have community-driven initiatives to improve health. And this is because it's aligned with the community's cultural responsibility of ensuring that our children of 8 generations are healthy. And I'm sure most of us are not thinking that way. Okay? So this is where my study comes in. My study comes in to reintroduce this KSDPP school-based program back to Kaniwage. But why schools? Any answers? Okay. So schools, because studies have indicated that schools have been conducive environments for promoting health. But there are some challenges. We all agree that schools have priorities for academic priorities. And when we look at academic priorities and health promotions for school time, schools will always prioritize academic priorities. So if we want to reintroduce this in schools, we need to also check whether the schools are ready. So what is readiness? Readiness is a concept that has been used in health services and in business organizations, but very novel in education. We also see that the studies that have applied readiness in schools are very few. And so there's a very big research gap. And this is where my study comes in. So my study comes in to answer these three objectives. First of all, we'd like to re-engage the key stakeholders of the KSDPP. We'd also want to identify the health and wellness priorities within the schools to enable us to reintroduce the new school-based program. And we also want to realize or assess resources and opportunities within the schools. So how will the study design be done? First of all, we're going to conduct what we call a document analysis, where we're going to review relevant documents to ensure that there actually are resources that we can work with. Then, we're going to conduct interviews with knowledge holders in education and health promotion, like principals of schools and health promotion or promoting professionals. Then, we're going to conduct what we call a modified talking circle. So like you see here, what it is that it's a group interview, but it's suited for indigenous concepts. And then there's usually a token object like a stake or a feather that is passed around, and it's a mode of storytelling to enable us to get the resources that we need. Lastly, because this program is for children, we want to hear from the children. And so we'll have what we call a food environment mapping activity with them, where they'll actually sketch where they obtain healthy foods from in the schools. Together, we are going to obtain all this data and creatively develop a set of recommendations together with the community. And so we'll send these recommendations to the community, and together we'll ensure that whatever we're going to come up with will have some cultural relevance, and we'll also ensure that the community has ownership so that it can be sustainable. So what is the significance of my study? Once we are able to get the community to agree to the recommendations that we develop, we'll be able to contribute to reintroducing this school-based program to the children so that we can prevent diabetes in the future. We'll also ensure that this program is relevant and participatory, meaning that we're going to work with the community. We'll also ensure that it's appropriate and we want it to be sustainable. So we're going to include cultural context, because we know that usually once you have cultural context, language, once you have cultural food, cultural physical activity, some of these things ensure or enhance sustainability. And the readiness tool we're going to use can solve some readiness assessments that isn't done currently in literature. And with this, we hope to be able to prevent diabetes for future generations. Thank you very much.